Hello everyone. In the previous video, we have discussed question up to 120 and we will continue our MCQs. Question number 121. Latin word repertorium or repertoire means all except. So, repertorium or repertoire means an inventory, a table, a compendium. Question 122. T in null repertory indicates toxicological provings. 123. When more than one repertory is used to find the simillimum, it is called cross repertorization. 124. Which method of repertorization is called keynote method? So, fourth method is known as keynote method of repertorization. Next, which of the following symptoms should be included in the fifth method of repertorization? So, the fifth method includes temperament, family history, and etiological factors. Next, technical nosological terms are taken in which method of repertorization? Sixth method. Next question, which of the following is the standard method of repertorization? Total addition process. 128. Who differentiates patients and remedies into two main classes, hot and cold, for utilizing as eliminating rubric? Gibson Miller. 129. Uses of repertory include all except. So the uses are helps to study materia medica, used as a reference book and to find out complete symptom. 130. Symptoms which help to eliminate important medicine to facilitate the selection of simillimum is called eliminating symptoms. Next, problem definition of a patient include knowing the patient's predisposition, diathesis and disease. Next, the field which differentiate medicine is called potential different field. Question 133. Objective of case taking includes all except. So we will go through the answers. Objective includes to manage the case, to diagnose the case and to find the simillimum. 134. Individuals who do not take much interest in describing their ailments are called indolent. 135. According to whom a homeopath must know his patient spiritually, emotionally, physically, and socially? The answer is Elizabeth Wright. Which of the following mental symptoms is most important according to Kent? Jealousy. Which of the following is a physical general symptom? A particular symptom present in more than two locations, ailments from, and desires and aversion. 138. Study of old and recent symptoms helps the physician to understand progress of disease, dominant miasm present, and prognosis of the case. 139. Symptoms which are self contradictory and opposite in nature but found together are called paradoxical symptoms. 140. Logical resolving or separating of whole symptomatology into different components is called case analysis. Process of rearranging the information obtained from case taking to form a comprehensive image is called synthesis. Next question. Repertory is an index of symptoms. Next question. Indian author who wrote repertory are P. Shankaran, K. K. Sarkar, and N. M. Chaudhary. 144. In 1963, Repertory of New Medicine was written by Stephenson. 145. Number of grades in synthesis and synthetic repertory is 4. 146. Record keeping helps to access the miasm, to access prognosis and in second prescription. 147. Characteristic symptoms of a disease is pathognomic symptom. 148. Subjective symptoms are felt by patient. 149. Who finally revised BTPB? So N.K. Banerjee finally revised BTPB. 150. Best repertory is which one makes oneself. This was said by Dr. Kent. 151. In 1953, JAR, New Manual or Symptom Codex, was translated and edited by Hempel and Quinn. 152. In 1953, Dysentery and its repertory of medicine was written by Humphrey. 153. In 1876, repertory of new medicine was written by C.P. Hart. 154. In 1890, classified index of materia medica for urogenital and venereal disease was written by Carleton and Coles. Next question. In 1993, clinical repertories of new homeopathic remedies was written by O.A. Julian. 156. In Kant's repertory, medicine for the rubric hypocrisy is phosphorus. 157. Which of the following is a fastidious remedy remedy according to Kant? So the answer is arsenic and nux vomica, both are fastidious. 158. In Kant's repertory, medicine for the rubric squanders money is veratrum album. 159. In Kant's repertory, medicine for the rubric astigmatism is tuberculin. 160. In Kant's repertory, medicine for necrosis of nose is phosphorus. 161. According to Kant repertory, medicine for painless inflammation of throat is baptisia. 162. According to Kant's repertory, medicine for moist excretions in umbilicus is calcarea carb. 163. Medicine for sensation as if penis is absent in Kant repertory is cocaine. 164. In Kant's repertory, medicine for numbness in the region of kidney is Barbaris vulgaris. 165. In Kant's repertory, medicine for the rubric closing eyes in night excites cough is Hipperself. 166. In Kant's repertory, medicine for cough on writing is Senna. 167. In Kant's repertory, medicine for immovable chest is phosphorus. 168. In Kant's repertory, medicine for thick thick skin of souls is arsenic. Next question. The slow growth of fingernails, medicine is Antimonium crudum. 170. Medicine for brittle nails is calcarea carb and symphytum. Next question. Medicine for bad effects of overuse of silicea is fluoric acid. Next. Medicine for ears freezing easily is zincum met. Next is which of the following rubric is present in head chapter of Kant repertory? So the rubrics are sunstroke, cerebral hemorrhage and lice. 174. Which of the following rubric is not present in the eye chapter of Kant's rubric? So myopia is not present. 175. Hay fever is found in which chapter of Kant repertory? So the answer is nose. 176. Which of the following rubrics are found in face chapter of Kant repertory? So the answer are Lenian Izalis, Lockjaw and Rhizus sardonicus. Next question. Which of the following is not present in the mouth chapter of Kant repertory is peeling lips. 178. Which of the following rubrics are present in the chapter of external throat of Kant repertory? Goiter, swelling cervical glands and torticollis. 179. Which of the following rubric is not present in stomach chapter of Kent repertory? So the answer is food. Rubric bubo is found in which chapter of Kent repertory? Answer is abdomen. 181. Which of the following rubrics are present in rectum chapter of Kent's repertory? Cholera, hemorrhoids, worm. 182. Rubric urination is present in which chapter of Kent's repertory? Bladder. Next, which of the following rubric is present in kidney chapter of Kent's repertory? So the answers are Addison disease and suppression of urine. Next question. Which of the following rubric is present in urethra chapter of Kent's repertory? Gonorrhea, syphilis and cordy. 185. Rubric sugar is present in urine chapter of Kent's repertory. 186. Which of the following rubric is not present in genitalia chapter of Kent's repertory? So the answer is gonorrhea. Which of the following rubric is not present in genitalia female chapter of Kent repertory? Nymphomania, which is present in mind. 188. Rubric croup is present in larynx and trachea chapter of Kent's repertory. Next, rubric snoring is present in respiration chapter of Kent's repertory. 190. Rubric whooping cough is present in cough chapter of Kent's repertory. 191. Expectoration forcibly flies out of mouth is found in expectoration chapter of Kent's repertory. 192. Which of the following rubric is present in the chest chapter? So the answers are discharge from nipples, emphysema and paralysis of diaphragm. 193. Curvature of spine is present in back chapter. 194. Which of the following rubric is found in extremities? So the rubrics are anthrax, chorea and late learning of walking. Rubric yawning is present in sleep chapter of Kent repertory. Quartan, quotidian, tertian fever is present in which chapter of Kent repertory? Chill. 197. Which of the following rubric is present in fever chapter of Kent repertory? So all the fevers are present in fever chapter: septic fever, puerperal fever and yellow fever. 198. Perspiration of whole body except face is found in which chapter of Kent's repertory? So the answer is perspiration. 199. Which of the following rubric is not present in the skin chapter of Kent's repertory? The answer is wounds. Actually, in this question, the answer is marked ganglia, but that is incorrect. Wounds is not present in skin chapter, it is present in generalities. Moving to the next question, 200. Which of the following is present in the skin chapter of Kent repertory? Chickenpox, leprosy, and psoriasis. 201. Rubric cyanosis is found in generalities chapter of Kent repertory. 202. Which of the following rubric is present in generalities chapter of Kent repertory? Cancerous affection, anemia, and pulse. Rubric chorea is found in which chapter of Kent repertory? Extremities and generalities both. 204. क्योमोडो means इसको याद करने के लिए हम देख सकते हैं, जैसे क्योमोडो में एम आ रहा है तो मोडेलिटीज एग्रेवेशन एंड एम्ब्यूरेशन बोथ. बोनिंग हसन वॉज बॉर्न इन द ईयर 1785. 206. बोनिंग हसन वॉज ग्रेजुएटेड फ्रॉम डच यूनिवर्सिटी. 207. In 1843, who empowered Boning Hassan to practice homeopathy? Friedrich Wilhelm IV. 208. Which of the following is not a subchapter of BTPB, genital female. 209. Chapter Sensation and complaints of BTPB contain subjective symptoms, complaints or condition, and objective symptoms. 210. Bonning-Hassan was first to enunciate the principle of analogy, develop concordance of remedies, and give evaluation of remedies. 211. Which of the following is not a rubric of the relationship chapter of BTPB? So the answer is head. 212. Bonning-Hassan was a close friend of A. Lippi and C. Dunham. 213. According to Lippe, Bonning-Hassan was born in the year 1777. 214. What is the purpose of repertory? First, reference and guide in looking a particular symptom. Second, to make distinction between similar remedies. And third, careful study of all symptoms of chronic diseases. Next question is, value of a repertory depends on proper case taking, knowledge of repertory, and intelligent use of resulting analysis. Question 216. Knowledge of repertory one attempts to use is, the answer is, its philosophical background should be known, its limitation and adaptability should also be known. 217. Repertory is not used in case of, so the answer is when there is a clear indication for similimum. 218. Which of the following is not a synonym of concomitant symptom? The answer is primary symptom. 219. Peculiarity of an individual which govern to origin of peculiar concomitant symptom is called personal equation. Next, totality of symptom implies symptom picture, the case, and the individuality. 221. According to Bonning-Hassan, every homeopath should prescribe one and same remedy for identical morbid symptoms. 222. In the first repertory of Bonning-Hassan, the first grade medicine were printed in italics with blank space between each letter. 223. Scope of BTPB according to Bonning-Hassan. So the answer is bedside selection of remedies and guide to study materia medica. Next question. Who changed Bonning-Hassan original typography into capital, bold, italics and Roman? So T.F. Allen changed the typography. 225. Gradation. Roman in parenthesis is found mainly in which chapter of BTPB? So the answer is relationship of remedies. Next question. True regarding medicine graded in Roman in parenthesis. The answer is the medicine which are graded in Roman in parenthesis are doubtful to present in the rubric, occurs most seldom and require crucial study. 227. In the oldest edition, the first chapter of BTPB was Mind and Soul. Next, chapter relationship of remedies can be used in which type of cases? So, in both acute and chronic. 229. T.F. Allen added which book with original BTPB? So, the answer is Repertory of Sites of Body. 230. In 1993, Index of Aggravation and Amelioration was written by Neatby and Stunham. 231. Jar, work and repertories are translated by, so the answers are A. Hempel, F. K. G. Snelling, A. Gerald Hull. Next question. In 1879, Illustrated Repertory of Pain in Chest, Side and Back was written by Rowling R. Gregg. 233. In 1936, Therapeutics of Year was written by Charles C. Boyle. Next question. Repertory section of Homeopathic Therapeutics of Uterine and Vaginal Discharge was written by W. Eggert. Next question. Repertory on Leukorrhea and its concomitant symptoms was written by A. M. Cushing. Next question. In 1945, Repertory of the Warts and Skin Diseases was written by Drake. Next, in 1945, Homeopathic Therapeutics in Ophthalmology was written by J. L. Moffat. 238. Repertory of Convulsion was written by Santee. 239. Hahnemann recruited Ruckert, Gross, and Jar to prepare a repertory. 240. An attempt at showing the relative kinship of homeopathic remedies was incorporated in BTPB as relationship of remedies. 241. In the repertory of antisoric, the chapter sensation was generalities. In Bonninghausen repertory, Dash was given highest evaluation for the side left cases. 243, who claimed that he saw quite frequently the beneficial action of calcarea carb after lycopodium. So Bonninghausen claimed this. 244, application of the chapter of relationship of remedies in BTPB is to grasp the genius of the medicine, greater certainty in selection, and to find second prescription. 245, Kant appreciated concordance chapter of BTPB. Next, BTPB can be used in cases with paucity of general symptoms, lack of uncommon peculiar symptoms, and presence of modalities and concomitants. 247. In BTPB, the medicine added by T.F. Allen have lack of modalities and sensation. 248. Who first laid down specific condition for grading of rubrics for a particular grading of remedies for a particular rubric? So the answer is C. Herring. 249. First edition of JAR Symptomen Codex contains 29 chapters. And question 250. Clinically verified and confirmed symptoms has not been included in which repertory? So the answer is Allen symptom register. For now, we will end our MCQs. We have done our MCQs till 250, and we will continue from here in our next video. You can drop down any queries in the comment section, and I'll try to answer them. Thank you.